your thesis. So today we are going to focus on research approaches and designs. And I've structured this into 3 sections, targeting the 3 key or the 3 major research approaches. So for the first session, we'll be discussing quantitative methods and designs, the different variations of quantitative methods and designs that you may need when you're working on your project. And also you may encounter if you happen to work with interdisciplinary team on any project. We'll also look at qualitative methods and its designs, the variations of it. We'll have expansive discussions on these. And the last one, we'll look at mixed methods and its designs, looking at how to merge quantitative, qualitative techniques in one project, which is mostly currently, almost all ongoing projects mostly have mixed method elements into it. Even if the project is quantitative project, even in biomedical field, even if it's quantitative, you would find some qualitative elements into it, which usually refer to as implementation science approach. And so when we get there, we'll do expansive discussions on mixed method as well. Right, so let's look at the first method, which is quantitative design. And for quantitative, as most of you are already aware, this means that you are doing research or you're investigating a problem using numerical data. You are drawing on quantitative data. And so once you are using numbers as your route into, into knowledge, mostly the focus is to test hypothesis. Okay, the researcher may want to test some hypothesis to understand, are there causal relationship between some variables? And then also, most times the approach is on generalizability, right? When people use large quantitative data and conduct rigorous statistical analysis, the idea is to be able to generate the findings from the sample to the population where the sample was drawn from. And so these are mainly used for clinical trials, epidemiological studies, and also neuropsychological assessments as well, tend to be very quantitative based. Now, the quantitative method emphasizes on objectivity. We discussed this in the philosophical foundation. Objectivity, where it seeks to draw out subjective values. And so the only way quantitative methods seeks to achieve objectivity is to use numerical data to draw on statistical analysis. Okay. Now, so its foundation is fundamentally rooted in positivism. Positivism is the dominant philosophical foundation for quantitative studies. And positivism, both classical and post-positivism, are the dominant philosophies. But there are also other philosophies that people can draw on to do quantitative research. Pragmatism, for example, is one of them. Somebody can use pragmatism to do quantitative study. If the person is able to argue that quantitative method is the most pragmatic way of answering that research method, then the person can use pragmatism to quantitative research to do that. Sometimes too, critical realism can also be used, but predominantly when a person is doing quantitative methods, oftentimes you find that the person aligns with positivism, objective reality, statistical inferences, hypothesis testing, generalizability, and all of that. Now, as psychologists, you've come across different theories and all of that. Some of the mainstream theories that are quantitative heavy, for example, behavioral theories. So clinical psychology may want to explain, some behavioral modification using CBT methods and all of that. There's also the biopsychosocial model that neuropsychology also draws on for research. dominantly quantitative ones. In public health, for example, there's epidemiological transition theory, which is used to analyze the shifts in disease trends and disease patterns quantitatively. You know, the way the COVID crisis was managed, they relied heavily on quantitative data, looking at how the virus is evolving and how what do you call it? How people were contracting the virus at different geographical and age ranges. And so these epidemiological transitions also rely heavily on, it's also a dominant theory in quantitative research for public health. The other less dominant ones that mostly can also lends itself to quantitative methods. For example, I'm sure you've all heard of Bronfenbrenner's ecological systems theory, right? Have you come across this theory?
No, please.
Oh, okay.
No, please.
I see. Well, we'll look at that in subsequent discussions. But what of social learning theory, Bandura?
Yes.
Okay. So the ecological systems theory looks like how a person's behavior is shaped at different levels, from individual level to broader to the systemic level. And so sometimes social psychologists, for example, and critical clinical psychologists, for example, may use that theory to explain or to quantify the extent to which maybe environmental factors impact depression, for example. Okay. And so these are some of the theories. And so when you are doing a quantitative method, the theory you choose should lend itself to quantitative assessment. If you pick a theory that does not lend itself to quantitative method and you are using it in a quantitative study, you would have a hell trying to justify why. It doesn't mean it can't be done. It can be done. We'll look at how that can be done. But if you are doing purely quantitative, very positivistic quantitative method, then you have to make sure the theory you are selecting also lends itself to positivistic ideologies so that your methods align with your philosophy and it aligns with your theory. Okay. Now let's look at the main quantitative designs that you likely come across in data gathering. So we have mainly two quantitative techniques or two quantitative designs. We have experimental designs and non-experimental designs. Under the experimental designs, we have different kinds of experimental designs. I'm showing two here, but when we move into the discussion, we'll discuss more than two. We have true experiment, quasi-experiment. We'll look at under what circumstances are each of them used. If you don't want to do an experiment, and I bet many of you wouldn't do experiments because experiments can be very resource intensive and time intensive. Many of you are likely to do non-experiments. If you're doing non-experiments, there are other options, different techniques to do, whether it's observational or survey, we can also do that. So let's move into these discussions. So let's look at experimental designs first. Whenever somebody is conducting research and the person intends to manipulate a certain variable to achieve a change in another variable, then the person is trying to use experiment. For example, if somebody is interested in understanding whether exposure to violent cartoons can cause aggressive behavior in children, and this person wants to manipulate different children, some would watch some would watch aggressive cartoons, some will watch cartoons without violence, and then the researcher now wants to measure aggressive behavior in the children. This example constitutes a simple, very simple experiment. So experimental design is where the researcher systematically manipulates one variable, and that one or more variable, we call them the independent variable. This is what the independent variable is, what the researcher will manipulate to determine their effects on a dependent variable. And while they are doing that, they'll have to control for what we call extraneous variables. We'll talk about this. For example, if you want to find out whether violent cartoons lead to aggressive behavior, the key interest or the dependent variable is aggressive or aggressive behavior. But you understand that aggressive behavior can be affected by other factors apart from violent cartoons. Can somebody mention some factors that are likely to affect or influence aggression in children apart from watching violent cartoons? Which other factors do you think can affect aggression in children? So I was saying that if, for example, a researcher is interested in understanding whether watching violent movies or violent cartoons can cause aggression in children, the researcher is interested in aggression in children, and the researcher thinks that there's a certain independent variable, which is violent cartoons, that can cause aggression in children. But when you pick aggression in children, which is a key dependent variable, there may be several factors that are possible of influencing aggression apart from violent cartoons. So I'm asking you to give me some examples of factors that can influence aggression in children apart from watching violent. Parental factors such as what?
Such as the relationship the child has with the parents, or how the parents like correct him, beat him, like the parental connection with the child.
Okay, so
corrective measures with the parents, yeah.
So for example, parenting style.
Okay, parenting styles, yeah.
Okay. What other factors?
The parents' relationship themselves, father and mother relationship, how they address issues. If they normally fight, the children may pick it.
Okay, parent-child relationship. Okay, what are the other factors about children themselves? What factors about children themselves that can also influence their aggression?
The gene they brought from their parents.
The gene? Okay.
Yes. If there's an aggressive gene.
Okay.
Their temperament.
Temperament, okay. What other factors?
The child, the school mates, the friends the child have.
Okay, fine.
The type of play the child actually indulge in whilst in school or even at home.
Okay, that's true. And even as simple factors as gender. Is a child a boy or a girl? Right? It has an influence on aggression. Yeah. The age of the child. Which school does the child attend? And all of that. What's the child's economic conditions? All these factors can influence aggression. But these are not the factors that you as a researcher, you are interested in. Do you understand what I'm saying?
Yes.
Yes, because you are not interested in these factors, but they can influence aggression. They are called extraneous variables. Okay, so for every experiment, there are fundamentally three basic variables that you need to understand. The dependent variable, which is the key behavior or the key variable that you, the researcher, you are interested in, that you want to measure. In this case, aggression. And then you need to know your independent variable. What factor do you think is going to influence aggression that you want to research on? In this case, exposure to violent cartoon content. But there are other factors that can affect aggression apart from your independent variable, which is the cartoon type. And these factors, we call them extraneous variables. And all these three variables work together in an experiment. And there are different ways that a researcher engages with each of these three variables. So for the dependent variable, the researcher will measure it. For the independent variable, the researcher will manipulate it. And for the extraneous variables, the researcher will control it, will control the extraneous variables. That is why we say experimental designs involve systematically manipulating one or more independent variables to determine their causal effect on dependent variable, whilst controlling for extraneous factors or extraneous variables. Okay, so experiments can be used to determine whether there's a causal relationship between, let's say, an intervention and a psychological outcome. For example, if a psychologist is working with some group of people and the psychologist on a problem where the psychologist can use different interventions, there could be an experiment to determine which interventions works the best. During the COVID time, you know that different COVID drugs were developed, okay? And WHO was monitoring experiments of these drugs to find out which ones are effective, which ones are not, which ones should we use. And so that's an example of experiment trying to determine which interventions work best for which particular outcome. It can also be used in clinical trials for treatment efficacy. Okay, as you start engaging with your clients with treatment methods, over time, you may want to experiment which therapy works best. And for the neuropsychology, for example, you can use experiment to assess cognitive functions. For example, memory, executive functions, and all of those studies. Many of them draw on experimental methods. Okay, in public health, for example, experiment can be conducted to understand the effectiveness of public health campaigns. Oftentimes, you see public health campaigns on anti-smoking with some very horrifying images of somebody who has lung cancer. You come across these images, right? In various hospitals and all of that. And they write on top, smoking can kill you. Do you come across these images?
Yes, please.
Right. Other times too, especially when it comes to road safety campaigns. In the past, road safety campaigns tend to be very, very horrifying. They start showing some very horrible accidents with death and all of that on TV, hoping that it will scare people, drivers, to drive carefully. Okay? Over time, those kinds of adverts have stopped. You don't see road safety campaigns using these horrifying road accident scenes. Why do you think that is the case? Why do you think they've stopped it? Or you haven't noticed it?
We've noticed a reduction, definitely.
Okay. But did it ever occur to you why there have been reduction in this?
I thought they had lost funding.
Okay, that's interesting. That's interesting. But they are still advertising. They are still doing road safety campaigns, except that now they are not showing horrifying images, because there's been a lot of psychological and research into public health campaigns that shows that using fear-induced campaigns doesn't work. Okay, using fear-induced, using public health campaigns that induce fear into people can even be counterproductive. All right. Why do you think a smoking product or narcotic product, they write on it, smoking can kill you, but people still smoke? So you can't use death to scare people into behaving right. Okay, so many cultures have cultural provisions that can sometimes rubbish the fear of death. Okay, in the Akan culture, for example, actually people will tell you, "Yebewundienda." Have you heard of that statement before?
Yeah.
Good. So if you need to accomplish something and you have different approaches, which campaign would you use? Would you use campaigns that? So these days you'd realize that they are using a different psychological mechanism. This, you hear your family needs you alive and all of that. Do you get it? Trying to draw on communal love to help drivers to drive carefully. Have you noticed those kinds of adverts?
Yes.
Yes.
Good. So your loved ones need you alive. Your children need you alive. Your wife needs you alive. arrive alive and all of that, using pro-social psychological mechanism to promote safe driving. And so experiments can be conducted on various public health campaigns to understand which of them is effective, which one should we use, how can we promote healthy behavior and all of that. Experiments can help accomplish all this. So there are different fields and what experiments are used for. Clinical psychology, for example, RCTs, randomized controlled trials and experiments, can be used to test treatment for new treatments for PTSD, for example. Neuropsychology, there can be different experiments testing effectiveness of different cognitive training programs. In public health, I've already mentioned public health campaigns. Experiments can be used to achieve all of these. Now, let's look at different types of experiments. The first one is what we call true experiment. For every true experiment, the experiment allows itself to very rigid control mechanism. So mostly experiments that are conducted in the labs are mostly referred to as true experiment. So for true experiment, mostly there's experimental group and a control group. If an intervention is being tested, the intervention can be manipulated such that the experimental group will receive the intervention and the control group may not receive anything, or may receive what is already in the system. In the test of the COVID drugs, for example, those patients who were on the experimental group, they were receiving the new drugs. For the control group, you can't say because you are a control group, we will not let you receive anything. That would be unethical. So the control group was already receiving the standard care that was already there at the time. And at the time, COVID infections were being managed with malaria management or malaria treatment regimen. Okay, so they were managing the cold, the flu, the headaches, and all of that. They were managing those. So you need to have two groups, one experimental group that will receive the intervention, a control group that will not receive anything, or that will receive a placebo, or that will receive standard care, what already exists in the system. Okay, I'm sure you're all aware of placebo, right?
Yes.
Do you understand placebo? What's the meaning of a placebo? What's a placebo?
A placebo is any substance or anything that is not having the active agent, but then is given to see the reaction of the person. Like it's given the form like as a medication. So a placebo in a testing could be like somebody will be taking the malaria drug, whilst another person will be giving something, but it's not having the active ingredients of the malaria drug to see.
Good, that's good. So that's a placebo, something you give to your control group as a semblance to what the experimental group is taking, but it's not the same treatment regimen. It doesn't have the same content. Okay, that's for example, it happens when the people in the participants in both groups, sometimes they interact, so they may understand what's going on. You can't be giving my friend injection and you are not giving me anything. Okay, so once the researcher understands that the control group may know what the experimental group is taking, they may decide to give them similar treatments, similar substance, but the content of that substance is different from what the content of the substance in the ones that the experimental group is taking. So if it's some drug treatment, for example, the experimental group can be injected with that substance and the control group can be injected with water or some neutral substance that will not influence. Yeah, right.
No, I don't think I invited you. I think it's Ferdinand for.
So is that what is already going on?
Douglas, are you saying something? Hello, Douglas.
My apology, no.
Okay, all right, that's fine. And so these two groups, you need these two groups. And the participants in these two groups needs to be randomly assigned. Okay, you can't just, as a researcher, you can't look at somebody's face and say you go to experimental, you look at another person's face, whether you like the person or not, you say you go to control group. No. In a modern experiment, softwares are used for assignment, random assignment. So you put in the details of the person and the software will randomly assign the participants using some form of a method. That way, we are able to make sure that before the experiment, your participants have the same characteristics. Okay, your participants have the same characteristics. So that's random assignment. And so these are the three variables that operate within in a true experiment. Independent variable that will be manipulated, dependent variable that will be measured, and extraneous variables that will be controlled for. Now let's look at the different ways extraneous variables can be controlled for. You know, during the COVID, one of the things that was key on the COVID deaths are that people who contract the COVID and have some underlying chronic conditions are more likely to develop severe condition and even die from the from COVID. Were you aware of this?
Doc, can you come again?
So I was talking about the COVID. During the COVID, people who were contracting the COVID virus and were dying were thought to have some underlying chronic conditions such as hypertension, diabetes, stroke, or some form of respiratory condition.
Yes.
Yeah. So if you are doing an experiment and in one group, in your experimental group, all of them have chronic conditions, and your control group, none of them have, they are not the same from the beginning. Do you understand this?
Yes.
So because chronic condition is an extraneous variable, there have to be a way to control for it. So we'll look at the different ways to control for these extraneous variables. And I was using the COVID example. If you want to test a certain COVID vaccine, whether a certain COVID drug will work well on recovery, and you know that some form of existing health condition may be an extraneous variable, you may want to control for it. One of the ways of controlling for extraneous variables could be restriction. Restriction is where you remove the extraneous variables from the study. So for example, if you are testing a new drug for COVID, you may decide to say that existing chronic condition may be an extraneous variable. So I am controlling for it by restriction. And that means that any participant that has underlying a chronic condition will be removed from the study. The person will not be part of the study. So you add that as part of your exclusion criteria. So restrictions are applied at the level of exclusion, okay, where you are defining who qualifies to be in your study, who doesn't qualify. So whenever a participant has some identified extraneous variables, then you exclude the participant. That's what we call restriction. The other method is also what we call matching. That means that where you cannot remove or you cannot restrict that extraneous variables, you can decide to match them. So you may decide to say, okay, all the participants I'm having are all having some underlying chronic conditions. And so I am going to match them. So we are picking all participants that have COVID and also have hypertension. So you match them on hypertension. Or you can match them. For example, if you want to study aggression in children and you know economic situation, for example, could be a factor, but you cannot remove economic situation out of it. You may decide to say, okay, I'm picking only school children from public schools. I'm picking only school children from private school. At least we know that mostly children attending public schools comparatively or averagely have comparable economic circumstances. Do you understand what the matching means? So you match them on the extraneous variable that you cannot remove. Do you understand this?
Yes, please.
So can we say group them, like grouping them too?
No, the grouping hasn't come yet. The grouping hasn't come yet.
Okay.
This is about selecting them. You have to select them before you group them. So selecting them, who qualifies, who doesn't qualify. So you can match them on the extraneous variables in the selection process. Now, after they have been selected, now you are going to group them. The grouping, you use randomization to group them. Because the truth of the matter is that once you are studying human behavior, it is not every extraneous variable that you can restrict or match. If you're experimenting with some therapeutic approaches, for example, which approaches work best for, let's say, depression, and we know that personality differences even have influence on depression, temperament, and all of those things, emotional intelligence, and all of that. So it is not every possible extraneous variable that you can restrict, and it's not every extraneous variable that you can match. So after you've selected your participants, then you randomly assign them. Randomization will help such that the people you have selected will be distributed equally amongst the group, among both experimental and control groups, so that we are sure that because you randomly assigned, then we can be sure that the experimental group and the control group, they are similar on the variable you want to study. Is that okay? So mostly randomization happens after you have recruited your participants. You can do restriction before you recruit. You can match during recruitment, but after recruitment, you do randomization. Do you understand this?
Yes, please.
Good. So they will all work at different stages of the experiment. Before...
Doctor, can you explain?
Come again?
The matching. Can you tell me more about the matching?
The matching. Okay.
Yeah.
So the matching is where you are making sure that you are selecting people who are equally influenced by the extraneous variable. Okay. Those who are equally, that's why I use the COVID and then chronic condition example. So you are testing for a new intervention for COVID management, but we know that people with some underlying chronic conditions it has influence on their recovery. So you can match them. So you're saying, okay, for the purposes of the study, we are selecting if the participant has COVID and has hypertension and diabetes, the person will be included. But if the person has COVID and has stroke, the person will not be included. So it means that you are matching them on maybe hypertension and diabetes, so that you know that for all my participants that I've selected who has COVID, they also have this condition. So you've matched them equally. Do you understand what I'm saying?
Yes.
So for all these three ways of controlling for extraneous variable, they work at different stages. You can do restriction to decide who qualifies and who does not qualify. That will be what do you call it? Inclusion-exclusion criteria. So any variable, any extraneous variable that you want to restrict, you add it to inclusion-exclusion criteria. Okay? Any variable that you want to match, you add it to inclusion criteria. Do you understand the difference?
Yes.
Good. And then once you have used your inclusion and exclusion criteria to select your participants, now you randomize them. Randomize them means that you are giving them equal chances of either being in a control group or experimental group. So let's say that after we applied restriction and matching, so after we applied inclusion criteria, exclusion criteria, now we have selected 30 participants. These 30 participants, we are going to divide them into two groups, 15-15 each. So we will have to use some formula to make sure that they are equally dispersed. So we can, let's say align them and give them numbers 1, 2, 1, 2, 1, 2, 1, 2, 1, 2. Then we say that all ones are in one group, all twos are in another group. And then maybe we do some coin tossing. Okay, we do some coin tossing. Those, if the group 1 pick E, then they become the experimental group. If group 2 picks C, they become control group. Some way of ensuring a probability of belonging to any group at chance, giving them the same chance. That's what we mean by randomization. But because when you are using some manual methods, there may be some mistakes. These days, there are softwares, okay? There are software. All large projects are software. So once you recruit a participant, you enter the participant's detail into the software. Then the software will randomly assign the person. So the software can assign the first participant to control, second participant to experimental, or maybe first participant to experimental, second participant to control, third to this, fourth to that. So the software will be doing the randomization for you. Do you understand this?
Yes, please.
Okay. So that is true experiments. Now, examples of true experiments. Actually, we say randomized control trial. That is the easiest and the commonest example of a true experiment. Randomized control trials, RCTs. It's seen as the gold standard in experimentation, even though it has its own problems. And so, apart from randomized control trials, where you create groups, you create experimental group, control group, and all of that. It is not every experiment that you can create groups. Some experiments you can't create groups. You may have to work with one group. So you can have what we call pre-test, post-test control design. Pre-test, post-test control design. For example, if an educational psychologist or if a neuropsychologist is working with some educational institution to try to improve memory and executive functions of the students, they can do pre-test, post-test. Pre-test, post-test means that you as a neuropsychologist, you are going there with a neuropsychological intervention. But first, you will test the children. We call it baseline testing. That is a pre-test. You will test the children first. Then later, you will do your intervention. And after the intervention, you test them again. That is the post-test. So you have 2 groups of scores for every participant. And so their first score, which is the pre-test score, will be compared to the second score, which is the post-test score. So the participants are also controlled to themselves. That is what we call the pre-test, post-test control design. Do you understand this?
Yes, please.
Good.
Yes.
Good. So a neuropsychologist can look at cognitive functioning assessments before and after neurofeedback training intervention. Or a counseling psychologist may look at stress levels before and after a therapy. All of these are examples of true experiments. And then we also have a third one, which is called post-test only control design. Post-test only control design. This is, for example, mainly used within public health campaigns. Okay, for example, these days, one of the key issues that our public health system is facing, and our health system in general is facing, is availability of blood. Availability of blood has become a very, very serious issue. People go to hospital, they need blood, they are not getting. Pregnant women need blood, they are not getting. And so sometimes when a woman is pregnant, they can invite the husband, come and give blood, let's keep it. Have you come across these forms of issues?
Yes, please.
Good. Because the only way of getting blood is through voluntary blood donation, and people are not donating blood. Okay? So a public health campaign can be conducted, right? Or can be aired on various media platforms and all of that. And after those campaigns, maybe after running a 6-month campaign, the health system can measure donation of voluntary blood donation to see whether the campaign worked. Okay, the post-test has weaknesses because you find it difficult getting a control, but at least it's also considered as an experiment. So if you want to do true experiments, it can be any one of these. Randomized control, where you have control group, experimental group. You can do pre-test, post-test, where you have one group and you test them multiple times. Or you can do post-test only. You have one group, you test them once. Okay, you do your statistical analysis. Any question on designs, examples of true experiments? Any question?
Yeah, I have a question.
Yeah, go ahead.
I just want to relate the question to my topic.
Okay.
And then my topic is want to find solution, adapt about 3 therapies for early dementia stage.
Okay.
And so with this one, I'm anticipating maybe just about 15 to 20 participants.
Okay.
So with this one, are we going to use randomized control trial for that? I'm a bit confused about that. And
okay, so for 15 patients, randomized control trial is not feasible because the sample size is small. Okay, so your best bet will be pre-test, post-test. Okay, so you say you want to adapt like 3 different
therapies.
Intervention therapies or therapies. Are you merging them into one, or you are trying to test which of the 3 is more effective?
No, this one is just focused on the early dementia and how we can.
Yeah, I get that. My question is, how are you engaging with these 3 intervention therapies? Do you want to test each one separately to find out which one is more effective, or you are borrowing elements from each of those 3 to develop a certain one therapy that incorporates elements from all the 3, and then you test this new one you've developed?
Exactly. We want to test the new one that's developed.
So you want to borrow ideas from 3. You want to borrow ideas from the 3 interventions to develop your own intervention.
Exactly.
And test that intervention.
Yes.
Right?
Yes, Rick. Yes.
So your best bet is to do pre-test, post-test.
Okay.
Yes,
okay.
Pre-test, post-test. And then also for you to be able to tell us that this new one you have developed works better than the other 3, then you have to test the 4.
Okay.
Do you understand what I'm saying?
Yeah, I'm getting it very well.
Good. So all of that you can do with pre-test, post-test.
Okay.
So that means that you will have 4 conditions. You have four experimental conditions. So you have 4 groups. One group each taking the 3, and another group taking your 4. So for each of them, you pre-test and post-test.
All right.
And then you can do your analysis.
Okay. Thank you.
Yeah, but you still need further conversations on this. We keep having conversations of this so that you make sure you're able to generate data that is enough, because the sample size is small. So you will have to do multiple testing over time. Do you get it?
Yeah, I'm just guessing if it actually will get the participants because it's early stage. That is where
as for getting participants, once you collaborate well with health institutions, you should. All right. So let's move on. So now we are moving from true experiments. Now we are going to quasi-experiments. Quasi-experiment is where you lack the ability to do complete randomization. When you can't randomize people into different groups, then you do quasi-experiment. And quasi-experiments are usually used in real-world settings. For example, when you're doing experiments in hospitals and schools and communities, you are likely to use quasi-experiments. Quasi means that it looks like true experiments, but we are working with what nature provides us. Okay, we are working with what nature provides us. And so it's not everything that you as a researcher, you can have control over. For example, you can have non-equivalent group design. Non-equivalent group design. If, for example, you as a psychologist, you want to compare a certain therapy, looking at inpatient, outpatient. For example, if you want to test some trauma interventions, and you have some patients who have been admitted, and some patients who come for inpatient services. So some of your clients may be in a hospital, some of them may be at home. That is an example of quasi-experiment. Or if there's a community, you've implemented some community psychology interventions to maybe improve blood donation behavior, or to improve health behavior, or to reduce depression, for example. That would be an example of a quasi-experiment. So mostly true experiments are conducted within lab, in the lab setting. When you are doing your experiment outside of the laboratory, then you are doing a quasi-experiment. Do you understand it?
Yes, please.
Good. And so non-experimental control group design is an example of quasi-experiment. Also, interrupted time series design is also an example of a quasi-experiment. The case that's, sorry, the one who has a question on early stage dementia, I didn't get your name. Give me your name. Yeah, Robinson. Good. So, for example, if you want to track maybe their brain function over time, that could be an example of interrupted time series design. Okay, which will still qualify as a pre-test post-test, because you will not be taking them to the lab. Do you get it? They will not be coming to your lab to do testing. You may be engaging with them at the hospitals over time. Maybe you meet them every time they come for review. It's where you go and meet them and all of that. And so that would be an example of interrupted time series design. Is that okay? All right. Any question on quasi-experimental design?
And docs, so
yes.
From what we have learned, it looks like in Ghanaian setting, it will be very difficult to do the true experimental design, especially if you are doing your academic project.
It's possible to do it. It's possible to do it, but it's capital intensive. Okay. When you go to Legon, for example, ISE has a number of RCT projects running. Public health has a number of ICT projects, RCTs running. Here at the U has the number of RCTs running. I'm even a mental health expert on one RCT on nutrition. You go to Kolebu, Konfanoche, there are a number of several RCT projects running. They are very capital intensive. And so for a student project, if you are not on a funded project, chances are that you won't be able to fund RCTs. Do you understand it? Yeah, it doesn't mean you can't. So there are different ways you can do that. You can liaise with a group that has an RCT project ongoing, and you can layer on your own or draw from their data. Or you can design your own and see the financial feasibility to look for funding. There are different modalities. Okay, so it's not that it can't be done. It can be done. Okay, once you know how to work around the challenges, you can do it.
Okay.
All right. Now, the third type of experiment is what we call factorial designs. Factorial designs means that unlike the experiments that we've been discussing so far, where you have one independent variable that you are manipulating, in real world situation, you may be working with 2 or 3 or 4 independent variables at the same time. we call them factorial designs. So you are manipulating 2 IVs or 3 IVs at the same time, and you want to understand what their interaction effects are. Okay. For example, if an example of a factorial design could be what Robinson you are planning. Okay. Even though we haven't engaged too much for me to understand where these therapies are coming from, whether it's one therapy divided into 4, or there are different therapies and they will vary with intensity. So a therapy can study CBT effectiveness using the therapy type and the therapist experience. Okay, the therapy type and the therapist experience. The researcher wants to understand which therapy types works best, what therapist experience works best. So in terms of therapy type, the researcher can pick maybe 2 therapies, 2 different CBTs. And for therapy experience, the researcher can pick an experienced therapist and a less experienced therapist and test these 2 to find out how does it play out. Now, when you are doing this, we are looking for what we call interaction effects. For example, how does therapy experience interact with therapy type? So if you have a less experienced therapist doing therapy A and a more experienced therapist doing therapy A, which one works best? Do you understand the therapy, the interaction effects?
Yes.
Okay. So you can do, yeah. So Robinson, for example, in your case, when you do your projects and you want to publish, people would want to understand. So those people who carried out these therapies, what were their experience? If you pick people with the same experience, then that means that you have matched them on experience. So you've addressed that question. Maybe they all had 5 years of, maybe they were all early career therapists, or they were all experienced therapists. But the moment you begin to have that, some were experienced, some were early career therapists, somebody can tell you that then the effectiveness of your study is not in the therapy type, but it's in the therapist's experience. Okay. So to address that question, you can decide to do factorial design, where you pick therapy type and therapist experience. But the more you expand on this, then you need more sample. Do you get it?
Yes, I'm getting
Any
it.
design you choose, any research method design you choose has implications. Okay, so you have to understand it. So that is an example of a factorial design. Okay, a counseling psychology.
So Dr. Meaning,
yeah, go ahead.
Look, so meaning after you have chosen your design,
okay,
does it mean the factorial design will come as a sub-heading to that,
no,
or what?
No. Your research topic, your research questions, or everything will show you are going to use factorial design. Because you will set a research question on the effectiveness of the therapy alone, the effectiveness of the therapist's experience, and your third question will focus on the interaction between therapy type and therapist experience. So anybody who reads your research question and the person is a very good methodologist will know that you are doing a factorial design experiment.
Okay. All right. Okay. Getting it.
Good.
Thank you.
So, Doc.
Yeah.
Let's take Robinson's project, for instance.
Okay.
Can he himself administer the experiment or what he wants to test? Can he himself do it as an experimenter?
So he delivers all the 4 interventions?
Yes.
It's not feasible. It's not feasible because what is your experience? What is your training in all the 4? Do you get it?
Yes.
Yeah.
What's your training in all the 4? If you are not a qualified trainer, if you are not if you are not licensed to do that, then you don't qualify to do it in the first place. Do you get the conversation? Because we are talking about human health. So there are ethics to it. So a medical student cannot say, I want to experiment different surgery techniques. So I am going to perform 4 different surgeries. On whose relative? On whose relative? So I mean, there are a lot of ethical implications in representing your study, but as we move ahead, we'll resolve all these ethical, and then it will inform your design at every stage. Is that okay?
Okay.
Yeah. Yes. Every lecture we have will throw more light on, give you some ideas. All right. Any question on factorial designs? Okay. Then we go to single subject experimental design. Single subject experimental design. As a matter of fact, you can do you can do experiment with one participant. We call it single subject experimental design. So it focuses on one individual, mostly used in applied psychology and health. And also used in when studying rare health conditions. There are certain health conditions that you don't find too many people. Sometimes you just have one patient, and you can plan your experiments on that. Any questions so far on experimental designs? So these are the strengths and limitations of experiments. Experiments happens to be the strongest method if you want to infer causality. If you want to say this causes this, then experiment is the strongest. It also has the highest internal validity. Its internal validity is very high. And then also, experiment can allow you to control for extraneous variables. But experiment can be ethically challenging, like I was mentioning about Robinson. In your case, you are not a licensed therapist. Is that okay? So ethically, you are not allowed to implement any of the therapies yourself because you don't have your license yet. Is that okay? So ethical issues abound in experiment. Also, ecological validity is of concern. If you do your experiment in the lab, how applicable are they in the real world context? So you want to do an experiment as a neuropsychologist, clinical psychologist, and you bring your students to your lab to come and do the experiment. The way they behave when they are outside and the way they will behave in your lab are two completely different things. So ecological validity is of concern. And then resource intensiveness, I've mentioned this already. Okay, so when you intend to use experiment of any kind, you need to know what the limitations and the challenges are and how to work around these challenges. Any question on experiments before we move on to non-experimental designs? Any question? All right, if there's no question on experimental designs, let's move on to non-experimental designs, which are also referred to as observational designs. Now, in observational studies, you are not going to manipulate any variable. Instead, you are going to do your research to observe and analyze naturally occurring phenomena. So anytime you are not manipulating the variables in your study, it means that whatever you are doing falls under observational research. You are observing and analyzing data. Now, different theories can be used. And mind you, this is also quantitative. So classical positivism, post-positivism, critical realism, and all of these can be used in observational designs. And so observational designs, it examines variables as they naturally occur without without any form of manipulation from the researcher. You only observe the variable, or you only analyze the data to draw associations, to find trends, or to have some potential causal analysis if you want to do, for example, regression. Okay. They are used a lot in the field of psychology and also public health and social science broadly. Okay. because it helps to understand behavioral patterns in real life settings. How are people, for example, when every year they are reporting road accident statistics, or when the Ghana Statistical Service conduct population census and they are reporting statistics, when they are reporting inflation and all of those things. They are all examples helping to understand trends in real life. Okay, that can also be used to examine mental health trends, and it's also useful to study real psychological conditions. Okay, in public health, it can be used to identify risk factors. Okay, and it can also help to understand or assess health outcomes in populations. You know, all of these to be able to shape policies in very significant ways. Let's look at different kinds of observational designs. When we talked about experiment, we talked about different experimental design. So observational designs, let's look at different observational design. The first one is what we call cross-sectional studies. Cross-sectional studies. This one collects data at a single point in time. So the kind of research people do when they are doing their first degree, they go to the field and they collect data once to assess depression. You go and collect data once. We call it cross-sectional. Okay, cross-sectional. So, or maybe you go to some hospital to pick up their hospital records and you analyze that data. It's also cross-sectional. You do it once. So studying the prevalence of mental health conditions, trying to understand whether there's some association between stress and coping, in assessing cognitive impairments in individuals with traumatic brain. Once you take your data once, that's what you call cross-sectional studies. Okay, you can't use cross-sectional to establish causation because you pick the data once. So, for example, you went to some school, you checked depression levels, and you checked what do you call it? Maybe studying habits, and then you are saying this studying habit causes depression. No, you can only say that there seems to be some association between them, but you can't say this causes that because you only looked at it once. You didn't check it over time. Okay. And then also cross-sectional studies are susceptible to confounding variables. You are not able to control for any variable. So your results has to always be interpreted with caution. It doesn't mean when you do this part of this kind of study, it's not a good study. No, but there are ways to frame the research questions. There are ways to discuss, to report the findings, and there are ways to discuss it. You can't do cross-sectional studies and start discussing your findings like you did an experiment. Is that okay? The second observational design is longitudinal studies, which is opposite to cross-sectional. Longitudinal means that you are collecting data over time. You are collecting data over time. There are some studies that are ongoing that maybe can collect data every month for, let's say, 1 year. Some studies can collect data every 6 months for 6 years. Some studies can collect data for every year for 10 years. That's what we call longitudinal studies. Longitudinal studies, they are very strong because you can use to make causal inferences. And so they are stronger than cross-sectional studies. There are mainly two types of longitudinal studies. We have the panel studies, then the trend studies. Panel study is where you pick some individuals and you collect data from them every point in time. So you can go to a community and select 200 people to collect data from them. And every month you go to the same 200 people in this same community to collect your data for 1 year. That is a panel study. Trend study means that you can, in some community, you can collect data from 200 people every month, but they need not to be the same 200 people you collected the first data from. But once it's, let's say in Ghana, if you want to conduct happiness level every year, you can select 1,000 people. When this session ends, use the same link to rejoin. You can select 1,000 people and every year select 1,000 people. It may not be the same 1,000 people. It may not be the same individual. It can be different individual. But because we are studying them over time, It helps us to understand trends. If we are studying the same individual, then they constitute panel. Do you understand the difference? Do you understand the distinctions between panel studies and trend studies?
Yes, please.
Okay.
I think with a panel study, the disadvantage would be that you may not get them. If you take 100 people, by the end of the year, you may be getting about 70 or so.
Exactly.
Or still fighting.
Yeah. So panel is very difficult to follow the panel over time. Okay. People move, people travel, people lose interest, people pass away, and all of that. They could have moved from the geographical location you have access to. They could have lost interest in you. So by the time you go to your second data points, you don't find them. Okay. So trend studies are very flexible, but also trend studies also has limitation because they are not on the same individual. So it's very difficult to say this causes this. Okay. You can just say that this is a trend you're observing. Maybe over time, depression is increasing in Ghana. Over time, depression is reducing in Ghana. So they all have their advantages, disadvantages. And so when you are choosing, you have to make sure which advantages can I work with, which ones can't I work with, and all of that. Okay. So for example, if somebody wants to study the long-term effect of early childhood trauma on adult mental health, if you want to find out long-term effects of...
Yes, sir, let's continue.
Okay. So if you want to study long-term effect of childhood trauma on adult mental health, you may pick some children who have gone through trauma and study them into the adult years. Okay. So, I mean, there are some topics that you just can't go and pick anybody anyhow. It depends on your research topic. So sometimes your research topic will inform whether you should do a panel or you should do trend. All right. If you want to do job burnout trajectories in therapists over 5 years, this one it's very easy to do trend. You can do panel, but you can also do trend. If you want to assess cognitive decline in Alzheimer's patients over a decade, it's better to do panel than trend. If you want to track mental health impact of air pollution exposure, what do you think? As a topic like this, should you do trend or should you do panel?
Panel will do.
Panel will do, but trend will be better.
Tracking the mental.
Trend will be better because if you are doing panel and you are doing it in a particular climatic zone, what if some of your participants move from that climatic zone to a different climatic zone? Are you still going to go back to them? So you can always focus on people who are being affected by a particular climatic condition. Maybe in this community who have droughts, and so every year you can sample from that community. Okay, so trend will be a better option compared to panel. It doesn't mean you can't do panel, but trend will make it easier that way. All right, so that is a lot. Do you have a question?
Doc,
Yeah.
Yes, the trend is normally used for a community, not necessarily the people, right?
Usually, yeah. So level of analysis is important. Are you focused on the individuals or you want to focus on understanding the community or understanding the society? If you want to understand the community, then anybody living in that community can qualify as part of your sample. So trend will do. If you want to understand individual, then those individuals should be of priority. If you want to understand society, then people within the society constitute your focus. So you can always sample from that population. So it always depends on your level of analysis. What is your interest level? Is it at a community level? Is it at the national level? Is it at the individual level? Or is it even at the organizational level? Is that okay? If you want to understand maybe depression trends among universities in Ghana, then the universities are your focus. So once you enter into the university, the students you find there, for the first year, you use them. When you go there the third year, the students you find there, because it's still the same university. So level of analysis is important. You need to identify what's my level of analysis. And then that can also inform you whether you should do panel or trend. Trend panel mostly for when mostly if the individual is your, for example, I have a friend in the UK, a Kenyan friend in the UK who is looking at private equity investment flow to Africa. And he's looking at the last 20 years, the last 21 years, from 2020 to 2021. And so his focus was, his level of analysis was country level. So he collected data from 54 countries on private equity investment flow from in all the 53 or 54 African countries from 2000 to 2021, right? So that's an example of a panel focusing on the country level. Okay. Now, for limitations, it can be expensive, it can be time consuming, and then also lost to follow up. If the years are very long, if you are doing a 4-year trend panel compared to a 10-year trend, the longer the years, the higher the loss to follow up. Do you understand this statement?
Yes.
Okay. Any question on longitudinal studies? If there's no question, then we move to case control studies. Case control studies. This is where you are doing a study comparing people or participants with particular conditions and comparing them to participants with no condition. For example, during the COVID, people compared depression level among patients with COVID and those without COVID. Okay, so it's almost as if things you cannot do with using experiments, you kind of use case control to do. All right, what is the level of depression between married women and non-married women? So you compare married women to those who are not married to find out that's an example of a case control. So you compare individuals who have a condition to those who don't have that condition. So those who don't have that condition become the control that you compare them with. Okay. It can also be retrospective. Sometimes it can help you to look back in time to identify potential risk. All right. And then sometimes you can use this for rare conditions that are very difficult conditions that are very difficult to find. So for example, in clinical psychology, somebody can investigate early life adversities in individuals with schizophrenia compared to healthy controls. All right. So they pick individuals with schizophrenia and pick people without schizophrenia or people without schizophrenia. And you investigate their early lives. You conduct retrospective studies on them. And then you're able to tell that, oh, for those who have schizophrenia now, in the early years of their life, so and so happened. That same was not observed in the healthy control or things like that. Do you understand case control?
Yes.
Okay. Of course, it also has its own limitations. Okay. Case control, if you're doing retrospective, you need participants to remember their past. And some people cannot always remember their past. So there can be recall bias. Okay, there can be recall bias. And also you can't use it to determine causality. You can't say this thing that happened in the person's early childhood or adolescent years is what causes or has schizophrenia. No, you can only draw association and not draw causal inferences. So that's case control. Any question on case control? Are you asking a question? Okay. So the last one we are discussing on observational design is cohort studies. Cohort studies. This is where you follow a group of individuals over time. So in other words, what you try to use case control to do to understand people's retrospective history, you use cohort studies. So cohort studies is also longitudinal in nature, but this time you are studying a particular cohort. For example, let's say a university wants to do tracer study and wants to understand our students who are graduating in 2025, what are going to happen to them by 2030? So they can pick sample from that cohort and study that cohort alone over time. Is that okay? That is what we mean by cohort study. And so you can do the cohorts prospectively. You can study what their future is going to look like in 10 years' time. Or you can pick a cohort and study their past. You can also do retrospective. You study their past for the past 10 years. Let's say you have some group of people who have been reporting certain kind of dementia that you are observing. So you've kind of found 3 people like that. So you can use those 3 to do a cohort study. You can study their life forward, which is a prospective study, forward-looking, or you can sample them and study their past. In that case, it will be retrospective. Is that okay? Do you get a difference between cohorts and case control?
Yeah, Dr. Priest. So with the cohorts, for that one, can you determine the number of participants? Let's assume for the football players who have had concussion over time. Can you determine the number of participants that you're supposed to choose?
No, there are no caps there. It depends on your research question, but cohort studies kind of lend themselves to small sample size. Right? Cohort studies can lend themselves to small sample size, especially if you are dealing with a real health condition. You can use small sample size too. Yeah.
So let's say Azuma nursing and Buko.
Okay, so you can not as Azuma Nelson and Bukum. Or are you can study
I'm just
Azuma Nelson cohorts of boxers.
Exactly.
Yeah. Yes, you can study his cohort of boxers and maybe do retrospective if you are interested in their past, or do prospective if you are interested in their future.
Okay.
Yes.
Okay. Yeah. Thank you.
All right. Any question on cohort studies? And then we look at survey research. As for survey, we won't go too much into survey. Many of you already familiar with survey research, right? Using mostly questionnaire type of to gather data and to analyze some associations and all of that. They also draw, because they also draw on they can be very positivistic, largely. Okay. Now, this is where you use some standardized questionnaire or psychometric tools to collect your data. You ensure that your questionnaires are valid and reliable. We'll discuss these things, reliability, validity, in subsequent discussions. Now, there can be different kinds of survey. You can do cross-sectional survey, you can do longitudinal survey, you can do descriptive reports like population characteristics. You can also do analytical, where you collect data and do some regression analysis. That is analytical exploratory. Or you can also do some form of exploratory. Maybe you are gathering, for example, when we're going to do the election, there you find that some opinion polls. This person says, my data shows that NDC will win. Another person, my data shows NDC will win. They did exploratory survey. Okay. They did exploratory survey. Now, the way survey can be administered, you can do self-administer, where you let the participants themselves provide their own answers. Okay, they read and provide their own answers. That is what we call self-administered. Or you can do interviewer-administered, where you, the interviewer, you are sitting with the participant, like the way the census data was gathered. okay, an enumerator came to you. The enumerator was asking you questions and the enumerator was providing the responses on the tablet. That's an example of interviewer administered. Do you understand the difference between the two?
Yes, please.
Between self-administered, interviewer administered. Survey can be done online, where you send some link to some people to open and do. You can do it paper and pencil, that many people are familiar with, or you can do it as a mobile app. You know, these days when you use WhatsApp and other platform to make a call, as soon as you finish, they send you a question to answer, whether the call was clear or not. That's an example of a mobile app survey. Other apps are also developed to also administer surveys. Any of them can be done. Okay. Right. This brings us to the end of our discussions on quantitative methods. Quantitative methods. Any question on quantitative methods before we zoom into qualitative?
Yeah, Doctor, I want to ask a question about the theoretical framework, the theories.
Okay.
Yeah. I don't know, has it have something to do with the conceptual framework? Conceptual framework and then the theoretical framework. What are the differences there?
Okay. So we'll have discussions that solely focus on developing theoretical and conceptual framework. But for now, I would say there's a direct link. When you pick up a theory, every theory talks about concepts. So you tell us the concepts you are interested in that theory. And in your conceptual framework, you tell us how you are using that concept to inform your study. Basically, that's how it works. So conceptual frameworks are developed from theories and concepts that you pick from either a theory or a model that you're using. Okay. We'll have in-depth discussions on that so that you are able to develop your theoretical conceptual framework. Is that okay?
All right. Yes, please.
All right. Any other question before we move on to? Was somebody talking?
No, please.
Okay. All right. So let's move to qualitative methods. And so after our discussion, if you are planning of doing only quantitative methods, I'm sure you are getting some possible ways of designing your study to get your data. Okay. Let's also look at qualitative methods to see whether you would also consider qualitative methods and all of that. So qualitative methods, this one, the focus is on meanings, experiences, and social processes. When we talked about the quantitative, we said the focus is on objectivity, inference, causal inferences, generalizability, and all of that. For qualitative, the focus is to understand meanings people give to what they go through, their experiences, and their social processes. So here, subjectivity is important. Subjectivity is important. Here, no objectivity. Here, subjectivity is important. Context dependence, and also flexibility in the design. Now, you'd realize that objectivity, qualitative methods draws on interpretivist philosophies, so relativism, and then interpretivism, constructivism. So knowledge is constructed, okay, and is shaped by people's subjective experiences, their subjective meanings, and all of that. So how do we understand deeper meanings into what people go through on a daily basis? And so qualitative methods tend to be very inductive. It goes deep. It goes deep. Quantitative focus on assessing surface what is common to everybody. Qualitative goes on what is peculiar about these people or this person. Okay. So example of research questions that lend itself to qualitative research. How do individuals with chronic pain perceive self-identity? What coping strategy do refugee adolescents use for trauma? How do caregivers of dementia patients adapt? Or how do communities perceive mental illness? Okay, when you're asking these kind of questions, then it means that you want to dig deeper into meanings and experiences and subjectivities, all right? And so there are different kinds of dominant theories that are sometimes used: narrative therapy, psychodynamic therapy, attachment theory, cognitive adaptation, social representation theory, among other theories and models. I was trained with social representation theory. My mentor, Professor Akins, has expertise there. She was trained as a social psychologist in social reps. I was also trained in social reps. So that's it. So you can decide to pick a theory and be well versed in that theory and all of that. These discussions will follow as we move on in the semester, and also as your career and your training evolves. Okay. Now, what are the different types of data you can collect in a qualitative study? You can collect textual data, interviews, transcripts, documents, written responses, all of that. Textual data can be collected for qualitative research. You can also do textual and observational data. You can conduct interviews, you can use memos, you can do field notes, documents, and open-ended questions. All of these. You can also do audio data. For example, recordings of conversations or focus groups or interviews, or even recorded music, musical lyrics. Is that okay? Musical lyrics. You can do a whole study by asking some questions and transcribing some selected music, some selected songs, and do critical analysis to answer your research question. Okay. You can also do video data. You can transcribe, for example, a movie. Okay, you can transcribe a movie or a comedy skit or something like that, or even what do you call it, a digital footage or anything. And you can also do visual. You can collect visual data. You can use photographs, drawings, infographics, maps, pictures, and all of these. These days, there's what we call creative methodologies. Creative methodologies, how researchers draw on different data sets, different and novel data sets to answer their research question. And so maybe as we move on, those of you who may be interested in qualitative or mixed method research, you may consider creative methods, where you would draw data from sources that people mostly do not draw data from to use as part of your data. Now, let's look at different designs. So these are different kinds of data. These are not designs. Okay, these are different kinds of data you can collect. Unlike quantitative, where your data, you have only one data type, which is numerical, numbers. Qualitative, you have various data types, various data formats. That is different from designs. Let's look at qualitative designs. Qualitative designs. So there are four basic designs, four main designs we are going to talk about: phenomenology, grounded theory, ethnography, case study. You can do any of these in your qualitative research. So you don't just say, I'm doing qualitative. What kind of qualitative design are you? Are you doing phenomenology? Are you doing grounded theory? Are you doing ethnography? Are you doing case study? Let's look at what entails in each of these. Okay. So the first one, phenomenology. Phenomenology. Phenomenology is a qualitative research that focuses on individuals' experiences, the way people experience phenomena in their life, or phenomena in their life. That's what we mean by phenomenology. So, for example, I mean, whenever a new government assumes office, definitely people will be sacked from their jobs. We are seeing it now. We saw it in the previous government. Every government does it. What does it mean for somebody who has been unemployed for 10 years, has now been appointed, worked for 2 months, and the person is being asked to go home?
The government for life.
Right? What will be the person's experience of this? That will be different from somebody who has been in a job for 10 years and the person has been sacked. There will be different experiences here. So when you're doing phenomenology, your focus is to say that individuals experience phenomenon differently. So I want to dig deeper into how people experience their phenomenon. All right. So for example, if your research is focusing on caregivers of dementia, you can look at the experiences, and that could be a phenomenology. Now, there are two variants of phenomenology. If you are doing phenomenology, you need to tell us what kind of phenomenology are you doing? We have descriptive phenomenology and we have interpretive phenomenology. The descriptive phenomenology is kind of the early version of phenomenology, led by Edmund Husserl, who focuses on describing people's experiences. So they focus on understanding experience as people describe it. Okay. Now, what for Martin Heidegger took phenomenology to another level, focusing on interpretivism. He emphasized on interpreting lived experiences within social and cultural context. For example, if you want to understand experiences of childlessness among women, you can pick a woman who has been childless for, let's say, 20 years and study the person's experiences and all of that. That will be descriptive phenomenology. But the moment you begin to put the person's experiences within a particular sociocultural context, right? You begin to put the person's experience within their sociocultural world, then you are now doing interpretive phenomenology. So you are now interpreting the person's lived experiences within the context of their social world. Because if you have, let's say, an American woman of 50 years without a child and a Ghanaian woman of 50 years without a child, they will all have experiences of childlessness, but the meanings to them will be shaped within their sociocultural context. Do you understand this scenario?
Doc.
Yes.
We understand it.
Okay. Yeah. So you need to tell us which phenomenology you are doing so that we are able to follow you, the way you are analyzing your data, the way you are talking through your findings, the way you are discussing your findings and interpreting your results. Because you can't be doing descriptive phenomenology and be interpreting your results as if you are doing interpretive phenomenology. You need to let us know. Okay. So phenomenology focuses on subjective meanings and personal experiences. And so it also uses bracketing. For example, you as a researcher, you need to let us know what your biases are, and then let us know how you dealt with your biases, how you bracketed your biases to study this person's experiences. And it requires in-depth interviews. Okay, in-depth interviews, and you go into the data to find themes and patterns and all of that. Sample questions, research questions for phenomenological research could be, how do individuals with PTSD experience flashbacks? What is the lived experience of burnout among professional therapists? How do stroke survivors describe changes in their cognitive functioning? What is the lived experience of mothers navigating postpartum depression in rural communities? When you're asking these questions, then it means that you are interested in people's deeper experiences. And so you need to go deeper. You need to draw on phenomenology to be able to do this research. When you're doing phenomenology, you can use different kinds of data methods. You can do in-depth interviews. Okay, you can do in-depth interviews. You can also do diaries and reflective journals. Sometimes you can let your participants keep diaries. Maybe you go there every 6 months to do interviews. So you can let the person say, whilst I'm away, if things happen to you that will be of interest to our discussion, write them down and all of that. So whenever you meet the person, you collect diaries. And then some people also keep diaries naturally. And some people can offer their diaries to researchers to analyze and study them. And then you can also do observation. You can observe your participants as they go through their everyday lives. And then you can also, so you can collect all these three data in one study in trying to understand your research, in trying to answer your research question. In terms of analytical strategies, phenomenology, when you do phenomenology, you are mostly going to do interpretive phenomenological analysis, IPA. You can't do phenomenology and just say that I did thematic analysis. Thematic analysis is general, or I did themes, and you need to let us know there are thematic analysis that you can do, but deeper level phenomenological analysis, you need to do IPA. Next semester, when we do statistics data analysis, we would also do qualitative analysis. And so we'll go into how to do IPA and all of that. Now, any question on phenomenology? Any question?
Hello, Doc.
Yeah, Tom.
Yeah, can you do any experiments, notwithstanding your field, like let's say clinical psychology? Can you do any study that you want, or there are some restrictive or specific studies that you are required to do?
No, there is no methodological restriction to any subfield. So that if I'm doing clinical, it means I have to do quantitative. If I'm doing this, I have to do qualitative. No. Any field you choose, you can choose a method that best suits you. So you can do a very fine qualitative research as a clinical psychologist. There are a lot more clinical psychologists that do qualitative research. Okay, so don't let your field or the field you've chosen, whether neuropsychology or clinical, don't let it restrict you. Okay, you have to define the field. It's not the field defining you. Okay, so nobody should feel methodologically restricted. All right, Magdalene, go ahead. You have your hand up.
Qualitative research for using the caregivers of children living with autism, and then choosing a phenomenology as the design. Is it possible?
Very appropriate. It's the best design. Okay, it's the best design. Mostly caregiver research relies heavily on experiences and meanings and subjective words. So phenomenology is mostly the best. Yes.
And it's fit in clinical psychology, like you said.
It is clinical. Yes, it is clinical. Yes, it is clinical psychology. Okay. No, I understand your question. Because
I've been confused on where and how and
I know, right?
My research topic. Yes.
Yeah, I mean, what I intend to accomplish with this course for this semester is to do methodological philosophical emancipation to decolonize your mind. Is that okay? Because many of you would have boxed yourself into an area that, oh, once I'm doing clinical, I have to do this kind of research and I have to do this kind of research topic. And no, there's nothing like that. So a social psychologist can do caregiver research, a neuropsychologist can do caregiver research, a clinical psychologist who can do caregiver research. Even an industrial psychologist or an organizational psychologist can do caregiver research. An educational psychologist can do caregiver research. It depends on the research question you're asking, right? The philosophical, theoretical background you are coming into with the question, and then the methodological approach you are coming in. So there's no topic that is reserved for any field. No. There's no topic that is reserved for any field. And there's no research topic that is excluded, that excludes any field. And so please take notes. Is that okay? So that you begin to tear down, yeah, Magdalene, go ahead. You begin to tear down some box you've put, some ways you've boxed yourself in a particular way. Magdalene, have your hand back up.
Yeah, since your main focus is on the caregiver, can the condition of the children change? Like this time, not really autism, which is a mental health issue, but then like sickle cell.
Yes, like, it can always change.
It can always change, but it's basically the caregiver. That's the focus.
Yeah.
Thank you.
The condition can always change. Okay. Yes, the condition can always change. So don't ever feel restricted or boxed in to assume that, oh, once I'm doing this, this is the only thing I can do. Okay. I belong to a critical psychology subfield in a new generation. So innovative thinking is a way to go. When you're asking innovative research question and you want to draw on innovative methods to explore it, we'll be there to support you, to guide you to be able to do that. Okay. This Tom, you can go ahead with your question.
Doc, I was interested in looking at temperament and mental health vulnerability.
Okay.
Yeah, but I was told temperament, the 4 classical temperament is archaic, so I can't do it, but I have a keen interest in that area.
Yes, you can still do it. You can still do it. Well, you can use another methodology to do it. We'll discuss that very soon.
Okay.
Yeah, we'll discuss that very soon. Okay, any question?
Also,
yeah, go ahead.
Your supervisor, wouldn't your supervisor actually influence what you really want to do? Does it really depend on you, the student?
So it's kind of intersubjective. So your supervisor will guide you. Okay, your supervisor will guide you, because in as much as you have your interest, there are things that sometimes your supervisor can see and understand that you don't. So the supervisor can guide you to a particular way, but the supervisor will not necessarily dictate to you. Okay, a supervisor can convince you to work on a particular topic instead of the one you submit. If you see the need to do that, that's also fine. Is that okay? Sometimes you can say, oh, me, is this topic that I want. A supervisor may have a funded project that the supervisor may need a student or to come and work on some aspect of the data. You may be interested and say that, yes, I want to do that. And so in as much as we are talking about emancipation, the emancipation is also from your own self. Do you get it? So that you don't box yourself as if for this topic that I have in mind, this is the only topic that I can ever research. Apart from this topic, I can never research any other topic. That if I don't research this topic, I will not be happy and I will not be, no. Okay. Sometimes, as a matter of fact, if you are working with a supervisor on a project, it helps you to even know more, learn more, and build a broader competence that when you become an independent researcher, and if you want, you can always go back to the topic you have always wanted to do. Is that okay? But no supervisor will force his or her ideas on you. If it happens that a particular supervisor is forcing his or her ideas on you, you can always change the supervisor. Okay? So it's not it's not an antagonistic relationship, it's a partnership relationship where the supervisor seeks to build your competence. Is that okay?
Okay.
All right. Okay, so the next design, qualitative design we are going to do is grounded theory. And Tom, you can use this design to do that research you say you're interested in. Okay. If they say the 4 temperaments are archaic, you can do a sociocultural based research that will probably unearth new temperaments within our context. Okay. So grounded theory is it's an inductive methodology, and it aims to develop theories grounded in real-world data. Grounded theory doesn't start with some hypothesis or without some answer in mind. It starts with a general question, and then it goes into the real world to gather data to build theories from observation. Okay, so grounded theory is what allows any qualitative researcher to even research topics that nobody has ever researched before, to ask research questions that have never been studied before, or to use an approach that nobody has ever used before. But the key caveat here is that it needs to be systematic. You need to do it systematically. There are different variants of grounded theory. And if you're going to do grounded theory, you need to tell us which variant you are doing. So we have the Glaser and Strauss, which is the earliest forms of grounded theory. That is a classical grounded theory. classical grounded theory. So here, this is the kind of grounded theory that is so it's almost like a free range. You can start from any question you want. There's no structure to it. Okay, there's no structure to it. The structure evolves as you move, as the project evolves. So you can always go back and forth. It's very iterative. You can change research question, you can change participants, you can revise data, you can always go back, collect new data, you can discard data. That's a classical grounded theory approach. Or you can do Strauss and Coben, who use structured approach to grounded theory. Okay. Or you can do Chamas, constructivist grounded theory, who do co-construction of meaning between you, the researcher, and the participant. So for Chamas, you, the researcher, you are constructing meaning with your participants. So you are combining your subjectivity and the researchers and your participant subjectivity. So at the end of the day, whatever findings come out of it is based on the co-construction between you, the researcher, and the participant. Okay. When we maybe next semester, when we do critical analysis, we'll go detail into any of these. But in the reading test that I will assign for you, all of these will be discussed into detail. All of these, whatever methodology you want to use, you would have to read into detail to understand. Okay, so if you're using Glaser and Strauss, you have to read the Glaser and Strauss original paper, and it will tell you step by step what to do. If you want to do Strauss and Coben, you read a paper. If you want to do Chamas, you read all the papers Chamas have written on this, so that you develop the authority on this to do what you are doing. Is that okay?
Okay.
So you can use grounded theory to accomplish what you want to do, Thomas. If you are interested in temperament and mental health within the Ghanaian socio-cultural context, you can use grounded theory to do that.
Okay.
Yeah. Now, so grounded theory, you begin with no predefined hypothesis. The data guides your theory. So you may even start with no theory in mind. All you know is that I want to understand how temperament shape mental health within the Ghanaian socio-cultural context. You can start with this. No theory in mind, no particular philosophy, just a grounded theory approach, and no particular, no predefined answer in mind. You can start this. And then there's also a constant comparative analysis. Okay, you are always going back to your data to do what concepts are emerging. You're always going back to your data. And also, there are different kinds of data coding techniques. You can do open coding, you can do axial coding, you can do selective coding. These are analytical issues that we'll discuss next semester. You can also do theoretical sampling. If you're doing grounded theory, theoretical sampling is very important. Okay, if you say you're interested in temperament and mental health, who are the best people to sample for your work? You need to give a theoretical justification for why these stakeholders are the most important stakeholders to sample for my study. Is that okay? Maybe you can decide to say, I want to start with non-medical practitioners who engage with mental health at the community level. So the prophets, the traditional healers, the herbalists, these people who deal with people dealing with mental health, you can say I'm starting from there. Okay, you need to give a theoretical explanation to why you are sampling the people that you are sampling. Okay, so clinical psychology, for example, how do individuals construct meaning after being diagnosed with chronic mental illness? You can answer this, you can use grounded theory to do this. Okay, what process do people use to cope with long-term grief? You can use grounded theory to do this. How do caregivers of Alzheimer's patients adapt over time? You can use grounded theory to do this. And what factors influence how individuals adopt mental health services in underserved communities? So the most important thing is that what research question are you answering? Any field can do grounded theory research. Okay? Any field can do grounded theory research. Any question on grounded theory?
Doc.
Yes.
The
please.
earlier question I asked, please, can you go back to the previous slide?
Okay.
I asked whether you can do research in any field. It doesn't matter your field. You see that I've noticed you've always been listing clinical psychology, the research questions.
So I just put it there as a guide. I was trying to ensure that I've captured the people with different disciplines. It doesn't mean that this is the topic you have to do. I'm just giving example of research questions you can ask. But I obviously cannot list all possible research a clinical psychologist could ask or in all possible. So I just, for example, bring one research question per field. Is that okay? I can also delete the field and the questions can stand and anybody can answer that question. For example, how do individuals construct meaning after being diagnosed with chronic mental illness? A clinical psychologist can do this. A social psychologist can do this. A neuropsychologist can do this. Whatever. A social psychologist can do it. Is that okay? But the disciplines, you go in with your disciplinary tools to that question.
Okay.
So if you're a clinical psychologist, you have some concepts and theories and tools that you use to address such a question. If we're counseling, you have theories, concept, tools to use. So anybody can, and so don't let the fields I've listed make you think that it is only the field. Is that okay?
Yes.
That should answer that research question. No.
Okay. No. Thank you.
All right. So there are different kinds of data you can gather for your grounded theory research. You can do interviews and focus groups. You can add observation. You can do document archival analysis. You can add other creative methods like arts and all of that. You can collect different kinds of data. And when you are doing the analysis, you can do different kinds of analysis, open codings, axial, selective, memo writing, and all of that. We'll look at how to do all of these next semester when we do advanced statistics and data analysis. Okay. For this semester, the focus is on methods, not analysis. So we end at how you can get your data. Next semester, we focus on now you have your data. How do you analyze? Okay. Any question on grounded theory? The next qualitative design is ethnography. Ethnography. This is where the researchers focus on studying cultural groups and cultures in general to understand behaviors, beliefs, social norms, etc. Okay, ethnography. Now, if you want to do ethnography, there are different variations of ethnography you can do. You can do Brinslow and Co., who developed the foundations of modern ethnography. You can do symbolic interactionism to understand how human behavior through social symbols and meaning. Is that okay? So somebody can understand the meanings people attach to mental health by looking at cultural symbols people use to represent mental health. Okay, that could be symbolic interactionism. Or you can do critical ethnography, where you do power dynamics within cultural groups. So how do power dynamics play out in mental health services within Ghanaian sociocultural context? Somebody can do this research and do critical ethnography. Okay, so we are in the world of enlarged science where methodological innovations abound. You just have to be well versed and well read on methodology. Is that okay? So that you'll be able to know different methodologies you can use for the topic you are interested in. Now, I provide some examples of research questions. Here again, don't be overly focused on the fields I've listed. I was just trying to make sure that I've covered the 3 key students I was likely to get. You see, I even had public health. Because when I mount the videos, for example, there are some of my public health students that I will let them watch the tutorial slides or the video as a foundation tutorial video before I meet them in class and all of that. So don't bother about the fields as if when I'm clinical, I have to do this. No. Okay. So you do ethnography. Once you are doing ethnography, you are going to do long-term immersion in the cultural setting. Okay. Sometimes you see some Western researchers move to Africa and come and stay in Africa for years, studying African culture, because they have to immerse themselves in the culture for a very long time. And then you can do the researcher, you act as participant observer. So you are a researcher, but sometimes you can participate in the culture. So you may be a researcher studying cultural dance and how it impacts mental health. And they are playing the cultural dance and you are dancing with them. Okay. So when you're doing ethnography, there's something we call thick description. You have to learn how to describe information and concepts in materials in a very, very thick way, such that when somebody is reading your description, the person can picture the thing in the person's mind. Is that okay? So if you are observing somebody with a caregiver with dementia, the person was going to the market. You can't just say the caregiver went to the market. What dress was the caregiver wearing? What time of the day was he going to the market? Was he holding a basket or what? What transportation did the person use? Sometimes even the color of the dress. How had the caregiver styled her hair? All of these could have implications. Is that okay? So thick description is very, very important. And then you can focus on doing either an emic or an ethic perspective to your ethnography. So if you're a Ghanaian and you are studying a Ghanaian culture, you are doing an emic ethnography. You are doing it from an insider perspective because you are part of that culture. If you are studying a culture that you are not part of, it's an ethic. You are telling us from an outsider perspective. For example, I am an Asante. So if I'm studying Asante culture within any Asante community, I'm studying it as an insider. Right now, I'm in an Ewe community. When I decide to study Ewe culture, I'm studying it as an outsider. I'm a Ghanaian, I understand, but I'm not an Ewe. So maybe to a foreigner, because I'm a Ghanaian and I've studied the Ghanaian culture, to the foreigner, I've done an insider research. But when you zoom down, you know the nuances. Like it is said that a forest, when you are very far, you think that all the trees are one. But when you enter into the forest, then you know that every tree has a stand. I'm sure you are familiar with this proverb, right?
Yes, please.
Good. So because you are a Ghanaian, if you do any study on any culture in Ghana, to an outsider, to a Western person who is not a Ghanaian, you have done an insider ethnography. But when we zoom in, when we are a group of Ghanaians and we meet, that means that we've zoomed in. Then we will understand that, oh, no, you are a Ghan. You studied a Mamprusi culture, so you did an outsider perspective. But to an outsider, to a non-Ghanaian, this thing may not be necessary. Do you get it? But you still need to understand these nuances. Okay?
Okay.
Right. So somebody can ask a question: how do indigenous communities conceptualize and treat mental illness? Or how do indigenous communities conceptualize and treat dementia? Or how do indigenous communities conceptualize and engage with Alzheimer's? Any field can ask this question and use ethnography to research it. Right? Any question on ethnography? So when you're doing ethnography, you can collect data, use different techniques to collect data. You can do observation, you can conduct interviews, you can have informal conversations, you write field notes, you do reflective journaling, you can gather visual and material artifacts, you can gather different types of data, and there will be a way to bring all of them together to analyze them systematically and to tell a scientific story from it. Okay, you can do different kinds of analysis. You can do thematic analysis. You can do narrative analysis. You can do discourse analysis. You can do critical ethnography analysis. You can do different kinds of analysis. Like I keep saying, for analysis, we deal with that in next semester. Is that okay? Any questions so far on ethnography? So the last qualitative design we discussed is case study. Case study. When we talked about quantitative, we talked about case study. Qualitative too, you can do case study. You can get one person. You can use a single case and do in-depth study into it. That's what we mean by case study. Okay, and you can use different variants. You can do the yin approach, the established structure approach. You can do the constructivist approach, where you focus on understanding the different realities of this particular case. Or you can use the pragmatist approach, where you decide that I'm going to gather different methods about this person. Okay, so maybe one person you are studying as a case, you can talk to the person himself or herself, you can talk to the person's children, you can talk to the person's classmates, you can talk to the person's family members, community members, household members, you can observe the person, you can analyze the person's pictures, you can read the person's journal, you can follow the person's social media handles to understand what the person puts on social media. You are drawing multiple methods, so you are using pragmatists, okay? Because you want to gather enough data about this person as much as possible, okay? Qualitative methodologies are very flexible. You just need to have that flexibility to know how to merge them together. Okay, so for qualitative study, usually focus on either a single case, or you can do two or more cases for comparison. You can draw multiple data sources, okay, and then you go in depth. You can either do exploratory, do explanatory to understand why did the person do what they did, and all of that. Okay, and then I provide some sample research questions, but like I keep saying, don't let the fields I've listed there box you to think that this question belongs to this field and that question belongs to that field. That's not it. I just wanted to capture different examples from different fields. Okay, any question from case studies? Can use these data collection methods and also these analytical strategies. Any question on case studies? And that also brings us to the end of our discussion on qualitative approach and designs. Any question before we move to our last session, which is mixed method?
In most cases, the supervisors sometimes give the number of pages that the researcher is supposed to cover. Basically, if you look at quantitative, it's not numerous as compared to qualitative. So with qualitative, do we have a specified pages that's supposed to cover? Because I know the things that are very plenty, and most students actually doesn't even want to do qualitative research. Do we have a specified pages that's supposed to cover?
Okay, so let me take your question let me answer your question from behind. As a matter of fact, there are more students who want to do qualitative because many people fear statistics, or many people hate statistics and mathematics. So they think qualitative is about telling stories. So you just go and gather interviews and come and tell stories. So many people like to do qualitative study. But unfortunately, qualitative is not just about telling stories. It's about using systematic ways. And it doesn't mean qualitative is voluminous than quantitative. No. Quantitative can also be very voluminous. If you need to do various missing data analysis, preliminary data analysis, and it can also be very voluminous. But for every institution, they don't necessarily restrict you to number of pages, but they can give a range. Okay, you can give a range. Maybe when you are doing maybe PhD, you should have maybe a range of this word count or a range of these pages, maybe between 150 to 200 or between 60 to 70. So there will always be ranges. The ranges are just as a guide, but not restrictive. Is that okay? The ranges are always a guide and not restrictive. But also, when you are doing research, the reason I say the ranges are just a guide and not restrictive is that research, we don't focus on the number of pages. No, we focus on the depth of your knowledge, the theoretic, how sound your research is, and the way it contributes to practice and to science and to theory. That is the focus. So somebody can write 70-page thesis for a PhD. Another person can also write 200-page thesis for a PhD. And they can all be examined and be awarded PhD, irrespective of the differences in page numbers. It is always the depth of knowledge in the work. Is that okay? So
yes, please.
Let that be your focus, your guiding lights. Is that okay? The depth of knowledge. Yeah.
Okay, thank you.
Okay. Any other question before we move to our third and final session? All right. So we've looked at quantitative approach and its methods. We've looked at qualitative approach and its methods. Let's look at a mixed method approach. Personally, as a way of disclaimer, personally, I did mixed method, both for my master's and for my PhD. I did mixed method. But I've kind of, I made it a personal resolve to have competence in all these three methods. It's a personal resolver. In our old generation of researchers, you would find that the person will either be a quantitative person or a qualitative person, or a mixed method person. Rarely you get a mixed method person, right? But you mostly, and so usually when you are assigned to somebody who is more quantitative and you say you are going to do qualitative, the person will say no. If you are assigned to somebody who is more qualitative and you are going to do quantitative, the person will say no, because you are entering into a field the person doesn't have competence in. But the current generation of researchers are building competence across all fields. Is that okay? So personally, I have advanced competence in quantitative methodology, in qualitative methodology, in mixed methodology. And I do publications in all three. Is that okay? So yes, I encourage all of you to build competence in all three. Is that okay? To help your practice and your science. So let's look at mixed method research and design. Fundamentally, mixed method has to do with combining quantitative techniques and qualitative techniques in one study. So for one study that you want to do, you're going to gather quantitative data, you also gather qualitative data. So you are merging these two into a single study. Now, the approach helps to accomplish different things. For example, it can help us to triangulate findings. We can look at what the quantitative findings are saying, what the qualitative findings are saying, and we can compare and contrast. That's triangulation. Integration of the methods can also help to expand our understanding and our interpretation. And it can also enhance validity of our study. Okay, because if you are comparing numerical data to get a broader view and a qualitative data to get a deeper understanding, then it helps us to be able to have a very good understanding of our social world. Okay, so on philosophical basis, methodology integrates positivist and interpretivist approaches. And so you find that most mixed methods draw on pragmatism. In the early stages of mixed method, people use pragmatism as their foundational philosophy. But as mixed method advanced, you realize that you can draw on different philosophies to do mixed method. For example, both my master's and both my MPhil and my PhD, I drew on critical theory. Critical theory. My PhD, for example, I use critical social science philosophy as my philosophical foundation. And so mixed method is well advanced. And if you have competence in it, you can draw on different philosophies to gather your data. And so when you're asking questions that are complex, when you ask complex questions, mostly it's best to explore using mixed method. For example, how do patients perceive mindfulness therapies impact on PTSD? So first of all, this question will look at the way patients perceive it and the therapy's impact on PTSD. So you can draw quantitative data to test the impact of mindfulness therapy on PTSD, and also conduct interviews to understand how the patients perceived mindfulness therapy.
Doc, can you come again?
I said, if you ask a question like this, how do patients perceive mindfulness therapy's impact on PTSD? So this question can do two things. Part of the question can assess the impact of mindfulness therapy on PTSD, which you can use quantitative data to analyze. Part of the question can also look at how the patients made sense of the mindfulness therapies that they were taking through, which you can draw qualitative data to understand how they perceived it. Okay, so if you want to do mixed method, you need to ask questions that lends itself for these two forms of data. Is that okay?
Yes.
All right. Now, let's look at different mixed method designs. If you are going to do mixed method, what design are you going to do? There are three key designs in mixed method research. The first one is explanatory sequential design. Explanatory sequential design. The second one is exploratory sequential design. And then we have convergent parallel design. So these designs have to do with which one do you do first. So for example, you say you want to gather mixed method data. So you gather quantitative, qualitative. Which one will you gather first? Will you start with quantitative and then gather qualitative? Or you start with qualitative before you go to quantitative? Or you gather both of them at the same time? Because whichever way you choose to do has implications on your research questions, on your methodology. Okay? Let's take them one after the other. So the first one, explanatory sequential design. This is where you do the quantitative first. And based on your findings, you go and do qualitative. So this one, it involves two-phase process. So you do a quantitative study. So you gather quantitative data to test your hypothesis. Once you know the results from your hypothesis, once you know the results, whether your hypotheses are supported or not supported, you know your results. Then you go and do qualitative interview to explain your results. Do you understand it?
Yes, please.
That is why we call it explanatory sequential. The sequential means one happens before another. One happens before the other. That's what we mean by sequential. So you can do mixed method using the sequential. And the sequential, you have these two. Explanatory, where you do the quantitative first. You get your findings. And then based on your findings, you go and do qualitative interview, or you go and gather qualitative data to come and explain your quantitative findings. All right. So for the explanatory sequential, quantitative comes first, followed by qualitative. So you do this either to interpret and contextualize quantitative results or to explain surprising findings. Let's say you do your research on depression and all the data are saying maybe depression is higher among women than men. But you go and gather your data and you find that depression is highest among men than women. And your findings are contrary to everything the literature is saying. You can go back to that community and try to understand, why is this thing highest among men? Because everywhere is highest among women. Why? What is happening with the men here? Is that okay?
Yes.
Yeah. So when you want to structure it, you first of all do your quantitative. So somebody can do a explanatory sequential. The person can do an experiment first, maybe an RCT or a survey or any other form of. The person can even analyze secondary data. Maybe this person wants to do a certain research, but the person gets a secondary data, analyze that quantitative data, and based on the finding, the person now go to the field to go and conduct interviews. That is also mixed method. Okay, that is also mixed method. All right. Any question on explanatory sequential? So if you look at this example, let's say there's a research topic on effectiveness of cognitive rehabilitation in stroke survivors, that somebody wants to do this research. The person can first do quantitative study to conduct RCT to measure cognitive functioning improvement using, psychological assessment. And based on the findings, they go and conduct interviews to then explain the findings. Okay, so this is explanatory sequential. Any question on this?
Okay, it's clear.
Okay, so the next design is exploratory. Okay, Magdalene, you have your hand up. Go ahead.
Yes, John. I was asking if you have to use the same participant for both explanatory and then the this thing.
Yeah, so there are instances where it will be good to go back to select some of the people you used in the quantitative. People. Yes. But okay. Always be mindful.
Okay, but it's not mandatory.
It always depends on the level of analysis. Are you trying to explain individuals or are you trying to explain a community? Okay. So if you are trying to explain a community, in the follow-up, it may not even necessarily be the same individual. Is that okay? And sometimes it can be the same individual. There's always a theoretical justification for what you choose to do. Is that okay?
Yeah.
All right. So the second design is exploratory sequential design. Exploratory sequential design. This design starts from qualitative first, followed by quantitative study. Qualitative first, quantitative. So this is mostly used when you are studying a phenomenon that is not well researched. So concepts are not well developed, theories are not well developed. There are not maybe there are even no available tools or measurements instruments there or something like that. And so this design will start with the qualitative data to explore the phenomenon. And once the phenomenon has been explored well enough, the concepts and the terms from the qualitative findings can then be tested using quantitative findings to be able to generalize the findings. Okay. Take, for example, Tom, who say you are interested in temperament and what do you call it? Mental health. You can decide to do exploratory sequential, where you start with a qualitative study to explore contextual meanings of temperament and contextual typologies of temperaments and their implications on mental health. And based on that qualitative research, based on what you get from that qualitative research, you can now develop skills to now use large sample size to test the associations you observed in the qualitative findings. Okay, so exploratory sequential, the first stage is just to exploit. And so this one is used to develop, mostly to develop theories and models or frameworks, or used to develop instruments based on the qualitative insights. And then it also helps to generate new variables that you can test quantitatively. Is that okay? So, but the quantitative should emanate from the qualitative. If you say you have explored qualitative, you've done qualitative research on temperament, and now you are going to do quantitative, and the skills you are using are the 4 skills of temperament that is already in the Western world, then why did you do the qualitative in the first place? You really didn't need to do the qualitative. Since your quantitative, you still use the existing tools. Why didn't you then just go ahead and do only quantitative? That would mean that the first stage of your qualitative didn't serve any purpose. Is that okay? So you have to make sure that your qualitative serves a purpose by informing the subsequent quantitative study. So here, in terms of the structure, the phase 1, you do qualitative. The qualitative can be focus groups, it can be interviews, it can be ethnography, it can be grounded theory, it can be any of that. And then based on that, you do phase 2, which is the quantitative design, which may be a survey or experiment. And then you now integrate your results together. You now integrate your results together. Is that okay?
Yes.
Good. So let's take, for example, somebody wants to research about trauma recovery in survivors of domestic violence. Trauma recovery. The person can first of all do qualitative study on how survivors of domestic violence or how people who have experienced domestic violence, how they are going through their recovery process or how they went through their recovery process. And based on what you get, based on certain key findings, on certain key concepts and terminologies and variables emerging, you can now do a follow-up quantitative assessment. Is that okay? Now, whichever method you choose to do will probably be informed by your research question and what you are trying to accomplish with the thesis. The third design. Yes, Douglas, go ahead with your question.
Thank you. So, in such as an example that you've given, what really is the what really is the benefit of the quantitative design that follows? Is it to make sure that you can find an objective, verifiable information that can be extended to the whole general population?
Okay.
Because I'm thinking if the phase 1 qualitative design has given you in-depth understanding of the question, trauma recovery in survivors of domestic violence, what's the point of the quantitative phase?
Good. That's a very, very good question you've asked. Like I said, the focus will always be on what you are trying to achieve with your study. If you are only focusing to understand trauma recovery process amongst maybe those participants, then the qualitative is enough. You have understood it among those participants. But if your focus is to understand it and also find out how widespread it is that okay? So you can do the qualitative process, the qualitative study maybe among 10 participants to understand it. And in the next stage, you want to understand how widespread is what I'm observing is among other survivors. Is that okay? So if you want to address that next question, then you need to do a quantitative, you need to add a quantitative technique to it. Do you understand the reason?
Thank you. Yes, I do.
Good. So it's always about what you are trying to accomplish with your research. If you are seeking to just understand what these people are going through, then qualitative is enough. Is that okay? And if you seek to understand what these people are going through and how comparable is what they are going through how you can compare that with others, then you need to add a quantitative component to it. And as a caveat, whether somebody does a purely quantitative or purely qualitative or mixed method, they carry equal value. Okay? They carry equal value. The essence is on to what extent is your research advancing knowledge and practice for us. Just because you did mixed method doesn't mean your work is twice as valuable as those who did only qualitative or only quantitative. No. So when you're choosing a method, prioritize contribution to knowledge and practice over methodological volume. Is that okay?
Okay, no.
All right. So the next, so the next design is the convergent parallel design. This is where you are collecting both data at the same time. In the sequential, you do one before the other. In the convergent, you are collecting data at the same time. Okay, so here you collect the quantitative data, qualitative data at the same time. You analyze them separately, and then you merge them to answer your research question. Now, let me put this in context. You see, in the sequential, you go and collect quantitative data. You analyze it. You know your findings. Then you now use your findings to go and collect qualitative. That is the explanatory. In the exploratory, you collect your qualitative data. You analyze it. You know your findings. Based on your findings, you gather quantitative data. In the convergent, where we say you collect both at the same time, it doesn't mean you are going to, sometimes if you are one person, you collect, maybe you finish with a survey before you go and conduct interview. But you finish with a survey, you will not analyze it. You can just keep it. You now go and collect your qualitative. You now bring it. You then analyze them separately. One didn't depend on the other. Okay? One did not depend on the findings of the other. That is the only caveat. So the parallel, you are collecting them together. It doesn't mean that when you collect one before the other, it's no more parallel. No. When you collect one before the other and you didn't analyze, so the second data collection wasn't informed by the findings of the first data collection, that is still convergent parallel. Okay?
Okay.
Yes. So sometimes you can do this to triangulate findings, or you can do this to compare and contrast, or you can do this to look at to answer different research questions fundamentally. But mostly in convergent, because you are collecting different data, sometimes you may have different research questions for the different data. Maybe you may have a particular research question that the qual is answering and a particular research question that the qual is answering, and one doesn't depend on the findings of the other. Okay, so let's say somebody is interested in therapist burnout and coping strategies. How do therapists experience burnout and coping strategies? You can conduct a survey to assess the level of burnout among therapists. And then you can also do focus group to explore how therapists cope with their work pressure. You know that the second one is not dependent on the findings of the first one. Each of them is addressing separate issue. But when they are put together, it helps us to understand therapist burnout and coping strategies. Do you understand this?
Yes, please.
Good. So, which one should you choose when you are choosing a mixed method design? Should you do explanatory sequential? Should you do exploratory sequential? Should you do convergent? What are they based for? If you want to explain statistical results, then do explanatory. Do the quanti before you go and collect the quality to explain the results. If you want to develop new theories and frameworks and tools, you can do exploratory. Do the quali, based on that, develop new theories or new tools to test quantitatively. If you want to triangulate your findings, do convergent. Okay. In terms of timing, explanatory is conducted in 2 phases. Exploratory is also conducted in 2 phases because they are all sequential. So that means that both the sequentials are conducted in 2 phases, but convergent is conducted once. It's because you don't wait for findings before you go back to the field. In terms of data priority, for the explanatory, quanti comes first before quali. In terms of exploratory, quali comes first before quanti. In terms of convergent, they have equal priority. So any of them can come first. or any of them can come second. And then I give examples there. Is that okay? So this table will help you to make decisions concerning what you intend to do. So now I'm going to ask you, do you have any question? And then I'm going to pose a question on how are you revising your thoughts in terms of methodology and your topic? First of all, do you have any question on mixed method design in particular, or anything?
Yes, Doctor. I have question.
Yes, Robinson, go ahead.
My question goes with triangulation. How does it enhance the validity and variability of the findings?
Okay. So let me give you a practical example from my PhD thesis, which focused on community mental health in terms of the triangulation. So I had a tool of assessing symptoms of common mental disorders, depression, anxiety, stress. So I got certain prevalence of depression, prevalence of anxiety, prevalence of stress within those communities. In my qualitative data, where I was also asking them which mental health condition do they see mostly in their communities, when I was doing my interviews and focus groups, they were mentioning the different mental illnesses, but they were also talking about depression, anxiety. Is that okay? So where I talk about the fact that depression levels are high, I also make reference to the fact that it's also emerged in the qualitative data. Is that okay? And then I also use the level of the quantitative data and the qualitative data to also discuss prevalent mental health problems within the communities. So where I talk about depression, anxiety, stress from the quantitative data, and also the other conditions that they mention in the qualitative data. Okay, I triangulate them and I created a table on the dominant mental health problems within the communities. So the triangulation can be done like that. Is that okay? Yes. Triangulation can also be done to contradict. Sometimes let's say your quantitative data is showing that depression is very prevalent. But maybe your qualitative data, they are talking about depression is not important to them. Maybe they are more important issue to think about than depression. So you can triangulate the finding to such that quantitatively there seems to be high prevalence of depression. But from the qualitative data, the community doesn't take depression as a serious condition. And then you can discuss what this means in dealing with depression issues within the communities. How do you deal with a condition where objectively it's prevalent, but subjectively they don't pay attention to it? Do you get it? So the triangulation can always be done in a very nuanced way. Yeah.
Oh, okay. Okay. Thank you.
You're welcome. Thomas, go ahead.
Okay, Doc. I want to know, it's not actually pertaining to the last one that we have done.
At this point, the question can come from any of the things we've discussed for today. So don't worry.
Okay.
Good.
Right. I want to know whether a student can pick his own supervisor based on your interest and maybe you think your supervisor's interest.
Oh, yes. As a graduate student, you qualify to have your own supervisor. What it means is that you need to engage that supervisor. That, Dr. So-and-so or Professor so-and-so, this is this is an idea I'm having about my research, so I would love to work with you. Will you please work with me? Once you get the person's approval, you can let the HOD know or whoever will be doing the supervisory assignment. You can let the person know. At the graduate level, it's very flexible like that. Okay.
Doc, if it's like that, yeah, then Dr. Jinayuna.
My friend.
Then Josephine, you are true.
Look at you.
Josephine, you are true now.
Douglas, you have your hand up.
I have a question that I think you might have answered, but I missed it.
Okay, go ahead with the question.
I'm trying to look at the difference between research method and research design.
Okay. So research method is about the general methodologies available in science. The design is the specific one you are going to use. Do you understand it? So when you are writing your thesis, especially the monograph thesis, you have, let's say a normal monograph thesis in chapters. Your chapter 3 may be your methodology. So you may say methodology, maybe 3.1 introduction, 3.2 research design. Sometimes some people write research approach before they come and write research design. If you write research approach, you are going to discuss whether you are going to do quantitative, qualitative, or mixed method, and you give reasons why. And then when you go to design, which particular quantitative are you going to do? Which particular qualitative are you going to do? Which particular research mixed method design are you going to do? Is that okay?
Yeah.
Yeah, because when we pick quantitative approach, we've talked about different design. We've picked qualitative, we've talked about different design. We've picked mixed method, we've talked about different design. So when you are writing your methodology, let us know, are you doing quantitative, qualitative, mixed method? And why are you doing what you have chosen that you are doing? If you say you are doing qualitative, what specific qualitative design are you doing? If you say you are doing mixed method, what specific mixed method design are you doing? If you say you are doing quantitative, what specific quantitative design are you doing? You have to also let us know. So that's the difference. Does that help?
Very much so. Thank you.
Okay, great. Okay, if you don't have any other question, I am going to ask a question. So from our discussion so far, how many of you have been rethinking your methodology? How many of you are rethinking your methodology? And how are you rethinking it? Okay, Douglas.
So I was raising my hand to say I am rethinking it.
Yeah, I want to know the context within which you are rethinking. Maybe initially I was thinking this, but from this discussion now, I want to kind of get some idea.
Okay. I've always been of the school of thought that if you want to be taken seriously in academic field, then you have to do quantitative research design. Okay. And then in there, you have to do, in terms of the methodology, something that is easily generalizable and has strong validity.
Okay.
However, my interest is in research, is looking at drug and substance recovery.
Okay.
And now I'm thinking that probably a mixed method where I do the qualitative first will help me understand and have information on what is and what works. And then I can do quantitative later, depending on the results, to see how generalizable my results could be. So I'm beginning to get comfortable understanding that actually qualitative research design is equally valid.
Okay, that's good to know. That also means that philosophically you were positivistic from the beginning of before we started this class.
Yes.
I'm glad that I've been able to shape the way you are thinking through this. First of all, you need to understand that credible science is not methodology specific. Okay, credible science is systematically specific. Everything has to be systematic. So if you want to do quantitative, it's credible. You want to do qualitative, it's credible. You want to do mixed method, it's credible. And every of them carries the same power of credibility now. Okay.
Thank you.
Right. Any other person? Yes, Thomas.
Yes, Doc. Before we started this program, I was thinking about culturally adapted CBT versus standardized CBT in treatment of depression.
Okay.
But I started my literature review and the methodology, and I realized that it's going to be very, very cost intensive
Okay.
So when you gave us a course outline and then you mentioned synthesis, literature, systematic review, and then synthesis research, I started digging deeper into it and I realized that maybe I could do that one. So when I realized that I'm going to do that one because that one will not be capital intensive, I was told that the university does not allow us to do that research where you are not going to collect your own data. So I got confused, not knowing what to do. And then I decided to go for temperament and mental health vulnerability. And that one too, I was cut somewhere. But from what we have learned today, I realize that I can still defend that one, the temperament, with maybe combination of grounded theory and other designs that we have learned. However, I think getting a supervisor will be a bit difficult unless maybe I get somebody who is critical minded like yourself. So,
well, let me say that even the first idea that you had about mainstream therapy, culturally adapted therapy, you can still do it. You can still do it. So you can do, first of all, you can do your first research question can focus on systematic review evidence synthesis to systematically review evidence of what works best. Is it mainstream therapies or is it culturally adapted therapies? What works best? You can do your first research question can focus on that. You can also do another research question where you interview practitioners on their views on this. Do you get it? And then you can also do research to interview patients who have gone through both to understand the experience. So you see, there are different ways you can still accomplish the first one you wanted to do. So if you were abandoning the first one because of some perceived methodological constraints you were having, I would say then don't discard it, because there are several ways you can still accomplish that. In both ways, there are several ways that you can accomplish that. Is that okay?
Okay.
Yeah.
Okay, I see.
I mean, I'm glad we've been able to cover what I wanted us to cover for, because you've seen that we've had a very extended time. Because I wanted us to have the philosophical issues sorted out, methodological issues sorted out, so that in our subsequent engagement, we'll do more targeted engagements. For example, when I meet you guys, we are looking at applied discussions. What's your topic? How are you thinking through? How am I helping you shape it? How are you shaping your research questions and all of that, and data sources and all of that? So I would say don't discard the idea you had. If you're still passionate about it, you can do it. Several ways you can do that. That will be very rewarding for you. Okay. Okay. All right. The others, how are you thinking through? Yeah.
So, Doc, well, it seems mine has been discussed. So, but is it possible? I thought it is a experimental design where I'll use much of resume control trial.
You're asking if it's possible?
Yeah.
Okay. So
yes, please.
So I as a scientist, as an up-and-coming scientist, I need you to understand these two terminologies very well. Possibility, feasibility. Okay. Is it possible? Is it feasible? Is it possible? Yes, everything is possible in life with time. Do you get it? With time and resources, almost everything is possible. But is it feasible? I guess that should be the question. Do you get it? Okay. And so in my earlier submission, I was talking about feasibility for an RCT, because your participants are small, you have small sample size. So it's possible, but it may not be feasible. Okay. Plus other factors that will come in. If you want to do factorial design, then you will have to go through the factorial process of calculating sample size. Already sample size doesn't make it feasible. So possible, yes. Feasible, then that's where the conversation is. Is that okay? So
yeah,
we'll keep having conversation on this to be able to make sure that by the time the semester is ending, at least everybody would have had a breakthrough in terms of feasible methodologies, methodological approaches, the topics they are comfortable with. Is that okay?
okay. Yes.
All right. Lucky, you have your hand up.
Yeah, Doc.
Sorry,
I
this
want to
session.
find out.
Okay, Lucky, please hold on. This session will end in 10 minutes, and I'm trying for us to finish. Once the session ends, we'll call it a day. It's been a fantastic class today. Is that okay? Yeah, Lucky, go ahead.
Doc, I want to find now from you if somebody is having a critical theory, a philosophical background, and then he or she want to use ethnography design. Is it possible?
Yes, it's possible.
Okay.
Yeah, it's possible.
I'm grateful.
Yeah, sure.
All right. I'm grateful.
Yeah, that's fine. You're welcome. Any other? The rest, how are you? Let me mention those I haven't heard from today. Josephine, I haven't heard from you. Salom, I haven't heard from you. I think the two of you. Abena, for you, I haven't heard from you.
Okay, Doc.
Yes.
From our discussion today, I've learned to integrate and then draw insights from multiple disciplines to develop a more comprehensive approach. And then initially, I was solely basing on quantitative surveys, but then I am thinking of using a mixed methods to like develop a rich and then in-depth understanding.
Okay, that's great. It looks like my emancipation is working, right?
Yes, it is.
Yeah. I mean, part of that emancipation is also not to necessarily drop what you were thinking of at first, but to understand that what you were thinking of was not the only acceptable way, and that you can still do it, understanding that is not the only acceptable way, and there are several other ways. You just choose one of the several possible accepted ways. Is that okay? So, who else? Josephine? Lucky, your hand is still up. Is it the old one or is it a new one? But let Josephine finish. Okay. Josephine, please go ahead.
So with my topic, I was looking at the level of depression among the caretakers of CVA patients.
Okay.
And all along, I wanted to use the quantitative, using the online means to gather data. But the work, I'm still contemplating if the mixed method or the detailed qualitative would be more prudent to use.
Okay.
That's where the dilemma is.
All right, that's fine. It's okay. I mean, for all of you, when we meet in person, what I'm going to do is to ask you what your topic is and what do you hope to accomplish with it. Because sometimes what you hope to accomplish with also gives you insight into which philosophy is the best and which method is the best to use. Okay. How best should you frame your research question to be able to get you the best possible outcome? Is that okay? So I'm glad that all of you are reflecting on your individual subject matters. Okay. Any other question so far? Is there any other question?